Uptick in deaths from fentanyl. The health district is now sending out a warning to all Southern Nevadans.
Fentanyl is about 50 times more potent than heroin and about 100 times more potent than morphine.
Well, 63 people have died from fentanyl so far this year.
And 13 Action News reporter Austin Carter right now is live outside the health district tonight in Austin. Certainly there are questions if this uptick in deaths is due to the pandemic.
Yeah, there sure is. And that Valley doctor you just heard that soundbite from, well, she tells me she can't exactly say for sure if this does have to do with the coronavirus pandemic. But what she did say is much like with what we've seen during the pandemic, it's that social isolation that can lead to an increased drug use. Clark County saw a 125% increase in fentanyl-related deaths since this time last year. The health district says this is the first time the county has had more deaths involving fentanyl than prescription opioids. The data is unsettling. Between January and May of this year, there have been 63 deaths involving fentanyl or fentanyl analogs, drugs designed to mimic the effects of fentanyl. There have also been 53 deaths involving prescription opioids.
Fentanyl is about 50 times more potent than heroin and about 100 times more potent than morphine.
Dr. Crystal Riccio is an associate professor of pharmacy practice at Roseman University. She's also part of the school's drug abuse awareness team. Dr. Riccio says fentanyl is usually prescribed as a treatment for pain relief. On the streets, it can be injected, snorted, or smoked. Dr. Riccio says, unfortunately, a lot of people are not familiar with the drugs they're consuming, creating a fatal combination.
More and more we're seeing it not just mixed with other opioids like heroin to make it more potent, but it can even be mixed with meth or cocaine and someone would unknowingly ingest it.
173 Clark County residents have died from fentanyl since 2018. Most were men, and deaths primarily occurred among those 15 to 54 years of age. The health district and the Centers for Disease Control and Prevention recommends carrying naloxone or Narcan, which can help reverse an opioid overdose.
This is a box of naloxone. It has 2 nasal sprays that are available within that. These are free for the community.
Yeah, and speaking of that free naloxone, you can actually get some for free right here at the Southern Nevada Health District. We're at US 95 and Decatur. We also have more information on help and resources available to you on our website. Head over to ktnv.com. We're live outside the Southern Nevada Health District tonight. I'm Austin Carter, 13 Action News.